Welcome to this explainer. Look, today we are tackling a seriously frustrating mystery that plagues so many established general practices. We're going to break down exactly why clinics with decades of community trust quietly lose out on Google search, and more importantly, how you can safely configure your review asks to actually fix it. Let's just jump right into a reality that I know drives practice owners absolutely crazy. You've got a practice that has cared for the exact same families for 20 years. But then a brand new clinic opens down the road, and within just a year, they are totally outranking your decades of hard-earned community goodwill on Google Maps. You're on page 1 of local goodwill, but, page 2 of Google. It feels totally wrong, but it's really not a verdict on your medicine. So what's actually happening here? Well, it boils down to this. Google's local ranking algorithms, and honestly your prospective patients too, prioritize recency way more than lifetime reputation alone. A profile with 60 fresh reviews from the last 2 months reads to a new patient as currently excellent and busy. But on the flip side, a profile with hundreds of reviews from, say, 2022, that just reads as was good once. Long tenure quietly works against you if your review collections stalled out years ago. Now you're probably thinking, but our care is excellent. Why did our reviews just stall out in the first place? Well, here's the wild part. Roughly 99% of your totally satisfied patients will literally never leave a Google review unless you actively prompt them the right way. Unremarkable experiences, even in a great way where a concern was completely addressed and the wait was totally fine, they simply don't motivate people to open Google and post. Think about it. A patient comes in, gets their worries sorted out in a standard 10-minute consult. They go home relieved, and crickets. They just have dinner. But the patient who waited 45 minutes past their booking, or the one who hit a billing snag, oh, they are highly motivated. They will absolutely find the time that same evening to leave a scathing 1-star rating. Left alone, your public profile is built almost entirely by those motivated, unhappy exceptions. So, what's the fix? Well, logically, you just ask everybody to drown out the exceptions, right? But as practice managers, you rightfully fear this. A local cafe can blast a text to everyone, and the worst case is just mild annoyance. But in general practice, sending a cheerful, "How did we do today?" text right after a devastating diagnosis, that's not just annoying, that turns a simple ask into a massive wound. This caution is exactly what stops practices from asking at all. This brings us to a massive paradigm shift. You absolutely have to understand the difference between sentiment gating and clinical judgment. Trying to guess who's happy and only asking them is prohibited sentiment gating. It's non-compliant and it manufactures a totally fake profile. But excluding patients based on the clinical nature of their visit before you even know if they are happy or not, that is safe, highly ethical clinical judgment. Right. So this means you aren't avoiding the ask altogether. You are just being incredibly precise about who gets asked. We call this the exclusion map, and it is the absolute foundation of your review program. It's what ensures a review ask only reaches patients where it's actually appropriate. Honestly, it is the only way your reception team is going to trust the system enough to let it run in the background instead of quietly switching it off in a panic. So let's build out this map. Practically speaking, for a GP practice, we're looking at maybe 8 to 15 rules. You are systematically holding back the cohorts where a prompt would just be a terrible idea. We're talking mental health consults, sexual health, bad news and terminal diagnoses, bereavement, child protection, family violence, or anyone mid-complaint. You make the call on these sensitive types once, and that's it. Now, I know what you're thinking. If we exclude all those people, who the heck is actually left? Well, here's the fascinating flip side. Even with those really strict clinical exclusions in place, routine care still makes up the overwhelming majority of your daily volume. Standard consults, chronic care check-ins, immunizations, minor procedures, these eligible routine appointments are more than enough to build massive review volume. By simply mapping out those sensitive cohorts, you prove that an Ask Everyone system isn't a contradiction in medicine at all. Actually, scratch that. It's the safest way to finally give a voice to that massive, silent majority of your happy patients. The care is entirely in the exclusions. You ask all the eligible patients the exact same way, regardless of whether you expect them to be delighted or not. Now, there is a super important compliance layer to this, especially for AHPRA-regulated advertising here in Australia. For those tuning in internationally, AHPRA is a very strict medical advertising authority, and their rules are crystal clear. You must always frame your review requests as feedback on the practice itself. We're talking access, reception, waiting times, communication. It can never, ever read as a request for a clinical testimonial. Okay, so you've got your exclusion rules. You might be wondering, can't our front desk just manage this manually? Just evaluate who gets a text on a patient-by-patient basis? In theory, sure, someone at the front desk could decide. But in reality, that is a recipe for disaster on a chaotic Friday afternoon. It's perfectly fine on a quiet Tuesday, but when they are booking, triaging calls, and managing a packed waiting room, somebody is going to make a mistake. And if you accidentally send a peppy review text to a mental health patient, your whole clinic will instantly lose faith in the system. You just can't rely on memory under pressure. These exclusions must be set once as a clinical policy and then applied completely systematically. You need an engine quietly running in the background, making sure the right visits get asked, the excluded cohorts never do, and your front desk team never has to make those tough calls in the heat of the moment. And that is exactly what the X18 review engine does. Built specifically for medical privacy, it just pulls basic appointment metadata, like name, mobile, and time. Zero clinical notes, zero diagnoses. It automatically applies your exclusion rules, sends out the request so it looks like it came straight from you, and, this is huge, it has a private resolution flow. Let me tell you, that private resolution flow is an absolute game changer. Filtering intent before public post goes live is critical. When a patient indicates a negative experience, anything 3 stars or lower, that feedback is routed privately straight to your practice manager. It catches the person who waited too long before they hit Google. Capturing this privately drives a massive 94% drop in negative public reviews, giving you a chance to actually repair the relationship. So when you combine a safe exclusion list with an automated system like this, the results are frankly staggering. GP practices running this playbook typically see a 6 to 13 times increase in their monthly reviews. And remember, these aren't just generic ratings. These are high-quality, authentic reviews from that silent 99% who finally had the friction removed. This sudden review velocity creates something called the 90-day flip. By days 15 to 45, as those first 50 to 80 fresh reviews land, your rating starts climbing. By month 3, Google's algorithm completely rebalances the local pack. Your 20-year practice suddenly gathers enough fresh, steady data to completely close that recency gap. You reclaim your spot, outrank the new guys, and usually see a massive bump in new patient bookings. I want to leave you with this final provocative thought. You have already done the hardest part. You spent decades building genuine community trust and delivering excellent care. You aren't buying new goodwill here, you are just surfacing what already exists. So, are you going to let all those years of hard work stay hidden behind a stale Google profile? Or is it time to safely build your exclusion map and finally let your silent majority speak? The choice is yours. Thanks for joining me on this explainer.